First of all, what do you do?
I'm a dental hygienist.
Okay. And you've been restored.
Yes.
Full mouth rehab.
Right.
Okay. And that was done a number of years ago.
Mm-hmm.
And if I remember correctly, you have had some trouble with the right side as far as cleaning. Your hygienist, the person who cleans your teeth, was saying, you know, there's some issues on the right side as far as bleeding, and you're a dental hygienist, you should know how to brush your teeth, but what's going on? And x-rays didn't really show any issues with faulty restorations. The margins were all closed. It looked good. But there was a missing component that you knew, but we really kind of couldn't quite just put our finger on it. Mm-hmm. And so time went on, and he ended up needing 3 root canals on the lower right side,
Right.
which was the same side that you had the issues with bleeding gums and those kinds of issues.
Right.
And so we got the root canals done, but we didn't change the bite. We didn't dial it in. And so what happened after that?
I broke an Emax crown on tooth number 30 on the lower right.
And is that one of the teeth that you had a root canal on?
Yes.
Okay. So the root canal took care of the pain, but the bite's going to take care of the bite because it just broke the crown.
Exactly.
And kind of freeing up the bite and making room for you to close and go into movements.
Mm-hmm.
Okay. So what we're going to do today is we're going to use some recording equipment to see what the muscles are doing, see what the bite's doing, and then we're going to be making some very precise, start out very conservative, and just see how the bite frees up, what the data is telling us, and then of course we're going to know, how does the bite feel, how do you feel?
Right.
And you've been protected by wearing a night guard for a number of years to kind of manage symptoms related to having a bad bite. And that's, you tell me a little bit about that, what was going on with...
It was designed to keep my bite open, to relieve the tension, to keep me from having pain. And I've been 11 days now without my appliance, and the pain is slowly getting worse. And it's very focused on my right side. It starts in this area, and it goes all around my eye, through this area, into my ear, and down the back into the shoulder. And I'm trying real hard not to clench my teeth, but I do catch myself. My shoulders are up, and I clench. I wake up clenching my teeth.
Okay. Is that how often is that? Is that every morning? Is that a couple of times a week?
All day, all night.
Goodness.
I have to really work on keeping my shoulders down.
Okay. All right. Well, we're going to start out just taking some measurements,
Okay.
and then just talk to you about that a little bit before we do anything.
Okay.
just like we did on Friday, you're going to slide to the right, okay?
What does it feel like to you?
It feels that kind of I want to say a cool feeling more than as it's been feeling kind of hot and swollen, and it feels a little cooler. It feels free. It doesn't feel so tight. Doesn't feel as tense. And it was very strange when you were adjusting that it felt really good in some of those areas that you were adjusting. Like I could just sense that was going to relieve some of that pressure. It felt really good. It was very comfortable. It feels great now.
And your teeth?
My teeth feel good when they come together.
I feel like you have more room in the
They
back?
feel like there's freedom. They feel there's just a sensation of coolness in my face. It's real strange.
Well, good.
Yeah.
All right, so you and I will follow up in the next week or so, and we're going to do this again, and we'll see how you're feeling, and we might fine-tune this a little bit as we're playing with it.
Mm-hmm.
Okay?
Okay.
But most of the work is pretty much done.
Great. Yeah, it feels really good. It feels nice and relaxed and very loose, and I don't have that tension in this area that I had before. It feels great.
So tonight, do the same thing as you've been doing. Just leave the night guard out, and let's see how you feel.
Okay.
All right?
Thank you.
All right, you're welcome. Denise, you're back with us today. You had the Disclusion Time Reduction Therapy done. It's been a couple of weeks, and life's just been life, and I wanted to get you in here earlier. But I did have an opportunity to talk to you the weekend following the therapy. Can you tell me a little bit about what you felt?
So what I found is that I no longer wake up clenching my teeth. I don't find myself having any kind of jaw pain anymore, in particular the right side. And the nice thing is that my shoulder pain, that I didn't really put those two things together.
Yeah.
My right shoulder pain that had been so chronic for so long is gone.
Weren't you in physical therapy for that?
Yeah, at least it was almost 2.5 years.
Wow.
I've been in physical therapy.
And you went and saw your physical therapist
did.
like the following week?
Thursday, it was less than a week later from the DTR therapy. I went in for my appointment, and she said I no longer need to see her, and she's released me, and I have no pain since then.
Excellent.
It's really amazing.
Good. So if anybody is watching this and they're considering, should I have this done or not, what would you say to them?
Well, my only thing is that I wish I would have had this done a long time ago. Having gone through the physical therapy and those twice a week, those appointments, and all of the time that I was dealing with that situation, and not knowing that I could be pain-free in just an hour of having the DTR therapy, I absolutely would recommend anyone that's even considering or is curious to at least consider having the DTR therapy. Absolutely.
Great. Denise, I'm probably going to shoot another video, just an addendum to this one, in a year. And I want to see where you're at in a year and how you feel. Okay? Is that all right with you?
That'd be great.
All right. Thank you very much.
Thank you so much.